welcome. We are here at the Fraum Center with our friend Dr. Heather, and I'm so excited today to meet Dr. Brian McGinnis. Thank you so much for joining us.
Thank you for coming.
You know, it's fun to talk to the two of you together because Dr. Heather and I talk a lot about scope of practice, and one thing she's shared is that you really are a broad spectrum group here. You offer a lot of things: restorative medicine, preventative medicine, proactive medicine, all kinds of things.
That's right.
So talk to us a little bit, if you will, and I'm going to ask you to kind of jump in here first. How does everybody play together? Tell me about the roles.
Well, you know, we have several different providers, and you know, we certainly have patients who show up seeking one of us out individually, but we all come from a different discipline, a different background, different perspective. Which our patients really get the benefit from. Because I may have a patient coming to see me for neuropathy, Dr. McGinnis will probably notice their gait abnormality, and he's gonna, you know, just watching him move through the office, and he's gonna come to me and be like, "Hey Heather, that patient, I'm really worried about their back. You need to get them in with me." And sure enough, we go take some x-rays, and they've got a huge scoliotic curve that's probably contributing to at least part of their problem. And so patients really get the benefit from all of us being here together.
Talk to me about chiropractic in general. Has it evolved since you started? Because you said 25 years?
25 years I've been here, absolutely. So we started off 25 years ago. We were just focused on chiropractic adjustments, just keeping the spine aligned. But over the years, we found that we were missing some things. Like if somebody had a disc problem, we would often have to refer them out to someone else. So we sought out new technology and new providers so that we could deal with these problems individually. So as an example, for disc compression, somebody with a bulging disc, we found the non-surgical disc decompression machine. So we can take care of that problem in-house now rather than having to refer them out.
So what I really hear you say more than anything is it's really a holistic view of a person.
We look at the whole body, not just the one part that may be hurting or the one symptom somebody might have. So we're able to work together as a team to look at the whole picture and find out why is this happening.
So when people come in, typically, do they come in specifically to see you, Dr. McGinnis, Dr. Heather, to see you, and then because you're very collaborative as a team, you sort of kind of mix and match and see where the needs are?
Oh, absolutely.
How does that work?
Well, you know, for starters, you know, we're all here, our patients are here, so we tend to watch people as they're moving through the clinic, so there's that aspect. You know, when I have a spine patient, I'm going to Brian because Dr. McGinnis, sorry, because Dr. McGinnis has been doing this for so long, so effectively. He sees things on x-rays that I don't catch, right? So this little curve here is probably contributing to their symptoms going down their leg on this side, that sort of a thing. And so I have the benefit of walking into his office and going to see him. But the other thing is we, you know, because we do offer different disciplines, we have an in-office rule that if the patient needs to see one of us, that it's a referral to that provider, like they just get an appointment with that provider in the office.
What is restorative medicine versus a more, biomechanical?
Well, so restorative medicine, we're not just focusing on the one pain or problem or symptom. We're restoring their health by looking at the overall picture. So that may be that they have a back problem and they have a knee problem, but the knee problem probably came from the back problem. So that's where Heather comes in. I will come to her and say, this patient has a back problem, but you know, the knee problem, their knee has degenerated because of their back problem. So we're looking at the whole body together.
It's really pretty interesting how you both come together. You've got a really collaborative team. When we walked in, you were having a team meeting, and I think it's been really interesting. We actually had a tour before, and I think in our next segment, you've got to stay tuned to that one. We're going to be talking specifically about some of the things that you do, which I think are really fascinating.
We're always seeking out new technology, new ways to help people. So we're on the forefront of medicine, restorative medicine.
I can see it, I can hear it, and you all demonstrate it. So thank you both. Stay with us, more to come.